Sciatica and back pain is one of the number one reasons, or number two, the 1 and 2 reasons why people come into physical therapy in the first place. So in this video, we're gonna break it down, the anatomy, what's happening with it, so you can get a good understanding so you can keep a long-term fix. My name is Jonathan Rizika. I'm a doctor of physical therapy. I have a clinic in the Woodlands, Texas. We have 3 PTs, 2 personal trainers, 3 office staff. It's grown immensely because all of the clients that come in get better. So we put together programs for them and we do a lot of manual therapy. We want to loosen up that tissue. What we do that's gotten us to the next level is we teach people about their anatomy, about the biomechanics, and how to take themselves to the next level by doing manual therapy techniques on themselves and how to sequence it so they can continue to get improvement when they're on their own at home. And that's the benefit that you have of watching these videos, is that you'll understand where the sciatic nerve is, where the pinch points are, and that's what we want to go through so that you can get long-term relief. Now, there are 100 different presentations of sciatica. We've had clients that numbness goes down into their feet, it's stuck in their butt and doesn't change, it goes down the back of their leg, sometimes towards the front of the leg. If it's into the groin area, it's not a sciatica problem, it's other nerves. But sciatica, the back of the leg, down into the calf, those are some of those presentations. I actually had a client that came in a few years ago that he had a referral for a hamstring strain. And so I tested the hamstring. I pressed on the hamstring to reproduce his pain. I could not reproduce his pain. And then I started fishing around in the back and doing some things in the back, some back tests, and we found that he had sciatica. It was reproducing that pain in the hamstring. So it was actually sciatica, and it had skipped his glutes completely, and it was irritation that was happening in the hamstring. And so it doesn't always present the way that it should or seems. And so I've had clients that have come in and said, this isn't sciatica, I've had sciatica before, but if it's the sciatic nerve that is having a problem, then the sciatica is the issue. And so we have to look at all of the pinch points, and we have to look at the anatomy, and we have to look at it 3-dimensionally to get that nerve to be able to glide around. And that's the main thing, that we take stress off that sciatic nerve. Make sure to hit the subscribe button and hit the bell icon so you get notified of the videos that we're putting out. We put out 2 a week. You're not going to get bombarded. We want to make sure that you don't miss out on any of this content. You're going to be figuring out exactly how to fix yourself from home. We're going to go through the anatomy of the leg. So when we're looking at this leg right here, we have our sciatic nerve coming down back here into the glute muscles. And so if we pull this glute muscle off, then we can see that sciatic nerve coming out right here. So now we have our piriformis right here. And so we'll talk a little bit about Piriformis Syndrome further in the video, but that's one of the major pinch points. So we have the spine coming out. We'll talk about that, but nerves are coming out of the spine, come underneath these glute muscles and start coming underneath the hamstrings right here, running right here underneath both of these hamstring muscles, and you can see how the hamstring muscles bifurcate from each other. And so right in the middle is where that sciatic nerve is running. So running deep right here, and then it comes down into the calf, and you can see that coming all the way through into the inside, there you go, into the inside of the calf right there. So all of this muscle tissue is running over that sciatic nerve. So when we're looking at it and we're doing soft tissue work, we're trying to loosen things up, we've got to loosen up all these muscles so that that sciatic nerve can glide around underneath them. And that's what we're thinking about on the manual therapy side. And when we're doing interventions to be able to break up that tissue, we've got to loosen up those muscles because we have fascia that ties these muscles together. We don't have as much length in them. They're not gliding around. That nerve gets irritated and those muscles tighten up even more. So we've got to loosen up those muscles on the top side, and we got to loosen them up on the bottom side as well. And then we have to use them so that that nerve can glide around. So this is just a good viewpoint of where the sciatic nerve comes together and then runs underneath the hamstring right here. And so when we're going through our exercises, you can think about releasing those muscles. Another thing to look at with this glute coming across is that this is our gluteus medius. This is the TFL right here. This is the gluteus maximus. And then when I take this off, you can see this line right here. We have this gluteus minimus running underneath. So that minimus is underneath here. And so this muscle, and this muscle are all overlapping here on the side of the glute. And that's why that part's very important. And it's not near the sciatic nerve. So when we're doing interventions and we're releasing that sciatic nerve, we're actually releasing muscle tissue around the sciatic nerve, but not on the sciatic nerve. I don't want to be putting pressure directly on the nerve and grinding on it. I want to loosen up the tissue here and loosen up the tissue on this side so that that nerve can be gliding around. And so if you you understand that and you know what to do at home, then you're not causing more problems. And that's the goal. Let's just not cause problems with that nerve. We got to let it settle down. We got to take some stress off of it, and we got to use the muscles consistently. And when you do that, we've seen it consistently here in the clinic. When we do that with clients, they get great improvement and they hold on to it. The last thing with anatomy that I want to talk about is that we have this nerve running through right here through this gluteal notch. And so it's coming around to the back. And so we get a lot of clients that want to work on that sciatic nerve back here. It's just not as impactful and not as effective as working on the glute on the outside. And we can see it here on the spine that these nerves are coming out right here, coming underneath. This is the psoas muscle. This is the psoas, and this is the iliacus. Together they make up the iliopsoas. This is the biggest hip flexor in the body. So it will have an impact on where that sciatic nerve branches down and then comes out from the side. It's a big flat nerve that'll drive all the way down, but it's really close to the middle of our butt. So we want to stay away from the nerve. We're not trying to irritate the nerve. We're trying to break up tissue on the outside so it doesn't have that grip on it. Now, why doesn't stretching work? So if the sciatic nerve is irritated, then we'll get misfires in that nerve, and then muscle tissue will grip up around it. Your body's trying to create stability. And so if we just stretch it, all that muscle tissue is hung up around the nerve and it's pulling on the nerve, and that causes more irritation. So stretching the nerve itself is not helpful. Stretching the muscle tissue should be done with exercise. We should be getting blood flow at the same time. What we're looking for is that nerve to glide around. If you're doing a nerve glide from another physical therapist and you're feeling irritation that's shooting around, we know that nerve is just getting more irritated. So we want to just get blood flow in there, use the muscles, and get that nerve to move around and not be hung up. A major focus with getting long-term relief from sciatic problems is just loosening up that tissue. So we talked about loosening up the glute tissue here off to the side, talk about loosening up the hamstring on one side and then the hamstring on the other side, and then loosening up the calf. Those are things that we're going to do consistently to make sure that that nerve can glide around, but we're not going to push directly on the nerve. All the way down to the foot, we have pinch points for that nerve. The first one's gonna be in the spine. If I do side bending, if I do rotation, those things will pinch down in that nerve. And if you're experiencing sciatica, you know exactly what I'm talking about. You just side bend on that side that is bothering you, and it'll irritate it, it'll shoot pain right away. When we have sciatic nerve pain, if it goes down to the foot, it's very positive for it to go out of the foot and start going up the leg. That's what we're looking for. And if it gets centralized in the glute, then that's a good thing, but then we have to get it out of the glute. You may have a little bit of irritation in the low back, but we have to consistently get rid of pinch points all the way up, and we do that by doing soft tissue work all the way down the leg, even to the foot. We get a garbage term of Piriformis Syndrome. It's a catch-all. So that piriformis, when we looked at the anatomy earlier, we could see that the piriformis, that sciatic nerve was running right underneath that piriformis muscle. It is a big pinch point, but it's not a catch-all. It's not going to fix everything by loosening up the piriformis. And when you go directly into the piriformis, you're going to get a lot of irritation because we're beating up on a muscle that's right over the nerve. So if we can redistribute that stress to other areas, it's going to take the stress off of the piriformis and release that nerve. Now we also have to scale back a little bit and say, you have Piriformis Syndrome. Why is the piriformis so irritated? Why is the muscle so tight? It's an external rotator. Why is it so tight? It's because it's doing the job of other external rotators. So we have to strengthen up muscles in that vicinity so that we can get a long-term resolution from sciatica. That leads us into strength and tightness. So what we've seen clinically, everybody wants to do stretches to loosen things up. And it is positive to do stretches a lot of times. But most of the time, a tight muscle is a weak muscle. It's a muscle that is clinging on for dear life. So it's trying to create stability right there. So actually strengthening the muscle is a positive. And when we strengthen the muscle, we're getting blood flow to it and we're getting that nerve gliding around. If you've been struggling with this for any extended period of time, then we know we have weakness around that area and we have misfiring of the nerve and misfiring of those muscles. So we need to break that stuff down and then rebuild it, build it back up and get more blood flow. So looking exactly where we want to roll out the glute is really important because we see it so consistently that our clients come in and they want to put the ball right here because it feels good, or it's like it feels like a hot spot. But we go right here, we go down just a little bit, we take this away, and we'll see that we're right on that sciatic nerve. We don't want to irritate it at the same time. We want you to get a long-term resolution from this pain. Just chasing it and beating up a nerve isn't going to be beneficial. We got to give the nerve a little bit of time to relax. What we'll do is actually break up the tissue on the outside of the muscle. So it's going to be extremely effective to get over here. So I'm going to stand to the side. This is exactly how my glute is right here. I'm going to put this ball off to the side, almost perpendicular with the body. So, and I'll do it up against the wall, digging into it. I got to unweight that leg, but we got to make sure that we're right here where these muscles are overlapping and loosen up that muscle tissue. When you're doing things like that, breaking up tissue and loosening it up, we do that in the beginning because we want to increase mobility first. Then we'll do an exercise where we lengthen, get blood flow after that. So always do mobility first, but stay off to the side. You'll find hot spots over here because this is where we have 3 muscles overlapping, and where muscles overlap is where they get tangled up with fascia and they get stuck together. The easiest thing you can do to get relief today is to loosen up the outside of that glute and then follow it up with an exercise. And this is a PNF. It's proprioceptive neuromuscular facilitation, and nobody should care about that. It's just PNF stretching. And all that means is that we're using a muscle and then we're stretching it and then we're using it again. So what I'm gonna do is I'm gonna lay down. When I lay down, I always go to the side. I don't wanna put any pressure on my lumbar spine. So I'll roll to the side, I roll back. And what I'm gonna do is put this leg up here, and then I'm gonna rest for a second, let it settle in because I have a tendency to hold my breath. I'm gonna grab my leg here, grab my knee, and I'm gonna pull up to the opposite shoulder. I'm gonna hold this for 20 seconds. You can see that my hip's not coming up and I'm not rotating because I don't wanna pull on my low back. I just wanna loosen up the glute muscles right here. So I feel a stretch right there. I'm coming real flat towards my opposite shoulder. I'm pulling up this way, holding it, breathing for 20 seconds, and then now for 5 seconds, I'm gonna engage that glute and push against my hands. I'm holding that for 5 seconds, and then I come back into the stretch. And then I'm doing it 20 seconds, push back for 5 seconds, and then holding it again for 20 seconds. I'm gonna do that on both sides. Whether you have pain on both sides or not, we're gonna do it on both sides. Now, if this causes you irritation, we need to ease back a little bit. We're not looking to get full resolution in one day. Nerve problems take time. So give yourself some time and give yourself some leeway. Do this consistently, it's gonna work. We just loosen up that glute and then get some length and get some blood flow to it. We're getting things gliding around the way that we need to. Long-term relief is going to come from glute function. That's going to be coming from using my glutes to fire, keeping my Superman or Superwoman emblem stacked over my belt buckle and driving through this area. When I'm turning, I'm using my glute to be able to turn around. I don't want to be twisting in my back. That's what's going to tweak that nerve from the front end. Once I tweak the nerve, then we get misfiring, those muscles tighten up, and then the muscles tightening end up becoming a further problem. That's where we can't get out of it because those muscles are so tight. If the muscle is stuck in a contraction, then it can't contract and relax. It's just stuck in a contraction. We need our muscles contracting and relaxing. That's why we're going to do that glute rollout, and that's why we're going to get length in those muscles. Remember to stay in neutral spine positions. When we're bending over to grab something, that I don't do this with my back and I don't fold here in my back, especially if it's lit up right now, it's causing you problems. I'm gonna shift my hips back to grab something and come back up. I'm just maintaining those neutral spine positions when I do movements. I can do the same thing. We call it like a golfer's carry or a golfer's lift, where somebody comes down like this, like they're getting a golf ball. We're using one leg, but you can see that my spine stays in neutral while I'm doing it. I'm also keeping my head in neutral while I do that as well. If you found this video helpful, make sure to hit like and then leave a comment if something's not clear for you. We'll get that clarity. And then we have 2 other videos, 3 stretches that are really effective for sciatica. They're always going to have PNF stuff. And then also 7 don'ts about back pain. They're common misconceptions about back pain and exercise that people do, and they often make it worse. We'll see you in the next video. Get mobile and stay active.